Medicare Made Easy. Today we're going to discuss the parts of Medicare, what they cost, how you get them, and do you need to sign up for Medicare? That's all in today's episode of Medigap TV. See you inside. First, before anything else, before you can do a Medicare Advantage plan, Medicare Supplement plan, anything like that, you need Part A and B. A is almost automatic from when you turn 65, and we'll get into that a little bit more down the road. But you will need to get Part B. Nothing can be started until you take care of this. Now, you can put Part B on hold if you're going to remain on an employer group plan that has over 20 employees. So if your health insurance through work or a spouse's employer has more than 20 employees, and say you want to wait till you're 66, 67, you can put Part B on hold. You'll keep Part A, which doesn't cost you anything anyway, and you'll put Part B on hold. And when you decide you're going to retire 90 days before that, you'll start Part B. That is the only way that you can postpone Medicare Part B without being penalized. Now, for signing up, you sign up for Medicare Part A and B with the Social Security Department. It has nothing to do with if you're taking Social Security or not. Now, as the seniors usually have to work to 66, 66 and a half to get maximum Social Security, a lot of them are waiting to sign up for Part B and then getting Social Security. That has nothing to do with you getting Medicare. Okay? Now, if you're currently receiving Social Security benefits, you're getting a check every month from Social Security, then they will automatically enroll you in Medicare Part A and B. They will send you your Medicare ID card about 90 days before your 65th birthday. Part B has a premium, and that will be taken right off the top of your Social Security check. Now, if you're turning 65 or starting Medicare and you're not receiving Social Security, you will need to sign up for Medicare with the Social Security Department. You can also do this 90 days before the first of the month of your 65th birthday. So, for instance, if you're turning 65 June 17th, you would sign up 90 days before June 1st. When you sign up this way and you're not getting Social Security, they will bill you quarterly for your Part B premium. Now, that can be changed once it's all started and you can set up a different billing, but at the beginning, they will mail you a bill quarterly for the Part B premium. Now, to sign up, there's really 3 ways you can go about doing that. The best is to do it online at ssa.gov. So you're going to sign up on the Social Security website. You make an account, which is handy to have anyway because you can check your Social Security statements and things like that right online. But when you sign up for Medicare on the website, you can track the progress. You can see where it is and a lot of times you'll be able to see your Medicare number and your start dates and have all that information available before you even get the card in the mail. And then we can start looking at your supplement or Advantage plans or what have you, the other products, because you need that Part A, Part B start date and your Medicare number in order to look at other products. Another way you can do it is call Social Security. When you call Social Security, what most likely is going to happen is they are going to schedule an appointment with you. So you're not going to be able to do it on that initial call. You'll call up, say, I want to sign up for Part A and Part B. Then they're going to say, okay, we'll call you, and a month out, they'll set an appointment for you. Doing it that way, there is no way to follow up on if anything was missed, if it's progressing through the system. There's no way to follow up. You're just at their mercy to sit and wait by your mailbox. You can also call or visit your local Social Security department. If you live close to one, you can go in, sign up, and take care of all the forms right there. Again, for those not taking Social Security and you need to enroll, I highly advise to do it at ssa.gov. Again, you can sign up no earlier than 3 months before the month of your 65th birthday. Again, turn 65 June 17th. You can sign up 90 days before June 1st. So when will your Medicare start? There's only 2 ways that this can go. If you're turning 65, Medicare will start the first of the month in which you turn 65. If you're turning 65 July 10th, Medicare will start July 1st. The only way that this is going to be different is if your birthday is on the first of the month. So if your birthday is on the first of the month, it will start the month prior. An example, your birthday is July 1st. Your Medicare then would start June 1st. And you could also sign up for it 90 days from June 1st instead of July 1st. Now, if you're older than 65 and had Medicare on hold while you still had group coverage, you're going to need your employer to fill out Form CMS L564. And if they don't have it, give us a call. I can help you out with that. Email it over. But most human resource departments should have that CMS L564. It needs to be filled out by your employer, not by you. So they fill out the form, give it to you, and you will either fax it or drop it off at your local Social Security department. Now, some people might not be done working yet. And if you're still working, you really have 2 different options. If you're working and covered on your employee's insurance plan, your choice could be to enroll in Medicare for the first day of your 65th birthday, or you could stay on your employer plan and delay Part B until you retire. Again, this is based on your employer having more than 20 employees. If you have less than 20 employees with your employer, you have to sign up for Medicare no matter what you do. Now, with those 2 options, there's a few things you need to go through and figure out which is going to be the best choice for you. 1, you need to compare the benefits. What's your out-of-pocket maximum and deductible on Medicare versus what it is on your employer plan? Number 2 is your premium. How much is it costing you to be on your employer plan versus if you went on Medicare for a monthly premium? Number 3 is, are you taking any high-cost medications? This can be a problem with some Part D plans, and you really want to look at both sides of the equation to see which would be in your best interest. And finally, and probably the biggest one, is if you have a spouse that is younger than you and is depending on you for insurance coverage. Basically, the only thing out on the independent market is the ACA or Obamacare, and then we're going to need to look at and see what the pricing would be. ACA plans pricing is based on your age, your location, and your income. So that's a big factor in making decision. Now, if they have the option to go onto their own employer plan, that's something you could look at as well. Now, for all of you that are not working or that are retiring, don't worry. This is the last time I'll talk on this subject today because everyone's situation is a little different. But if you're someone that needs to compare these options, please click the link below in the description and set an appointment. That link will take you right to my calendar. You can pick a date and time that works for you, and then we can discuss the options, give you some realistic numbers, and then you can make a comparison with the information you need to make an informed choice. Other than how to sign up for Medicare, you're going to need to know what the term original Medicare is referring to. Medicare is made up of 4 parts, but when someone says original Medicare, what they're talking about is only 2 of the 4 parts. The 4 parts of Medicare are Part A, Part B, Part C, and Part D. Medicare Part A is your hospital insurance, and that comes from Medicare. Part A covers your inpatient hospital stays, skilled nursing facility, hospice, and some home health care. Medicare Part B is your medical insurance, doctors, outpatient care, medical supplies, and preventative services. Medicare Part A and B is Original Medicare, and those are the only two parts that you get from Medicare or from the government. Medicare Part C is a Medicare Advantage plan, and that is not mandatory. You do not need a Medicare Advantage plan. In fact, if you get a supplement, you will not have a Medicare Advantage plan or Part C. Part D is your prescription drug coverage. These plans are for your prescriptions, and you will need to have one in some form or fashion. If you're going to a Medicare Advantage plan, it will most likely be wrapped up into that as a MAPD, Medicare Advantage Plan Part D. If you're going with a supplement, you will have a standalone Part D. If you're going to just stay with Original Medicare and not get a supplement or Advantage plan, you will need to get, again, a standalone Part D. And we'll go into more detail a little bit further down the road. So again, Original Medicare is the term to describe Part A and Part B of your Medicare coverage. Now, Medicare does not pay 100% of the medical bills. There are some holes in its coverage, as I'm going to go through now. So, Part A, a little bit more in detail, covers your skilled nursing facility, nursing home, as long as it's custodial care. So, if you went in and, say, had a hip replaced or some surgery and they put you in a nursing home for rehab, that would be custodial care. If you are getting transferred to a nursing home because of your health, and this is a full-time move, that is not covered by Medicare. That is a long-term care insurance product, or that is something that either the state will pay if you're on Medicaid, or you will pay out of pocket. Nursing home care is only paid for Medicare for custodial or rehab care. Part A also covers the hospice and home health services. Part A has a deductible for 2023 that is $1,600 for each 90-day benefit period. Notice, this is not an annual deductible. This is a per period deductible. If you go in for one stay in January, you will have to pay that $1,600. And if you go in again in October of the same year, you'll pay another $1,600 deductible. Part A is also only going to pay 80% of the bill after the deductible, leaving you to pay 20%. The good news is, for most people, Part A is zero premium. There's no cost for Part A as long as you or your spouse have worked 10 or more years in your lifetime and paid taxes in. They call it 40 quarters. It breaks down to 10 years. So Part A hospital coverage does not cost anything for most people as far as premium. Now for Part B is your doctor's coverage or medical coverage. This is going to cover all those types of bills from your doctors, outpatients, surgeons, nurses, medical durable goods. It's also going to cover any medication taken as an outpatient setting, like your chemotherapy or infusions for rheumatoid arthritis. Those fall under Part B. Part B has an annual deductible for 2023 that is $226. Now, this is an annual deductible. You pay it once, and then you're done. Medicare Part B also only pays 80% of the expenses, leaving you with the 20%. Now, Part B has a premium, and most people will pay $164.90 per month for Part B. This is 2023 pricing. That can and will change every year, but your premium for most people will be $164.90. Now, that price is going to increase depending on income. For instance, for someone filing single with an income over $97,000, or a couple filing joint and has income over $194,000, you will pay more premium for your Part B. And that increase is called IRMA. That goes up incrementally, and there are different stages of it. So it's from 194 to 206 and so on. If you do fall underneath IRMA, it is looked back 2 years. So in 2023, they are looking at income from 2021. They review it every year. So in 2024, they would be looking at your 2022 income. If you're being hit with IRMA because of a sale, you sold your house and decided to move to your retirement or went into a condo or something like that, you can appeal the IRMA, and I have seen them reduce the premium. But they're not going to reduce it for everyone. You're going to have to fall under the established category. So the $164.90 will be taken out of the Social Security check each month if you're receiving Social Security. If you're not receiving Social Security, it's going to be billed quarterly like we discussed. Now, the way Part B works is, of any doctor bill, now this is assuming you don't have any Medicare Supplement or Medicare Advantage plans. You just have original Medicare. This is how this is going to work. So the way Part B works is you're going to pay the first $226 for the year, and then you're going to pay 20% of any medical bills. There is no out-of-pocket maximum for the Part A or Part B 20% that you are going to pay. So you will pay that 20% no matter how high it gets or how much out-of-pocket you have. Normally, insurance plans have what are called an out-of-pocket maximum. Medicare does not. Now, that's the scariest part of this whole thing. If you have Medicare just by itself, original Medicare, and you have a $100,000 bill, which in today's world doesn't take long to add up, that would leave you with a $20,000 bill. And I don't know anybody that wants to pay that. Now, Part C, like I mentioned, is a Medicare Advantage plan. And have you seen this guy in a commercial or some of the other retired sports figures or actors? They're talking about Medicare Advantage plans. And I want to warn you about these commercials, okay? A lot of the benefits that they're talking about, if you read the disclaimer that you see for a fraction of a second, aren't available to everyone or everyone in every area. For instance, they talk about some benefits that are only available to people that are on Medicaid in their state. So be careful calling that number when you see these commercials. I get calls every year shortly after that, hey, they switched me to a plan, my doctors aren't in network, or my drugs aren't on the formulary. They go to a call center, they are sold as leads, and it is not a good way of making a medical decision. If you want to discuss a Medicare Advantage plan and if it's right for you, please make an appointment at the link down in the description and we'll discuss it. There's no obligation. That goes directly to my calendar. I'm the only one that sees it. Nobody is going to call you except for me, and all that information will be on an email sent to you after you sign up for the appointment. Now, Advantage plans work very different. This is where Medicare is contracting out Part A and Part B services to a private insurance company. So if you go with an Advantage plan, you're basically exchanging your original Medicare for an all-in-one network type plan through a private insurance company. That company now is going to decide the deductibles, copays, coinsurance, and what your out-of-pocket cost is going to be. Now, they used to call Medicare Advantage plans replacement plans. It's a pretty fitting name, but CMS, who runs Medicare, no longer wants that term used. If you go with a Medicare Advantage plan, the Part D plan, like I mentioned earlier in the video, is normally included in that. A Medicare Advantage plan is not a Medicare Supplement plan. They are two very different products, although people will call anything they have to do with Medicare a supplement. That's not true. A Medicare Supplement, as you'll see later in the video, is a completely different product and is not part of Medicare. A Medicare Advantage plan is Part C and is the government paying a private insurance company to administer your Part A and Part B benefits. Now, all Part D plans are made up of these three parts. They're going to have a premium, a deductible, and they're going to have copay or coinsurance for your prescription. Although the premiums vary anywhere from $4 a month to $100 a month, they all have a premium. The deductibles vary. For 2023, most of the plans have a $505 deductible. Some plans have it on Tier 3, 4, and 5 drugs. Some plans have it on Tier 1, 2, 3, 4, and 5. So there's a lot of variance between the plans. And they will all have copays or coinsurance. Now, copays are set by where your prescription falls into the tiers. And even if you have your employer plan, your prescriptions, you may not know it or see it, but your prescriptions fall into tiers. Tier 1 is your lowest cost generic drugs. Normally the copay is $0 or $1. Tier 2 are just generic drugs, and they range anywhere between $2 to $4 a piece. Tier 3 is preferred brand. Normally it has a coinsurance. Some plans do have a standard copay for it, like $42, but most of them will have a coinsurance where you pay a percentage of the drug cost after you pay the deductible. Tier 4 are non-preferred brand name drugs, and again, they normally have a coinsurance where you're going to pay a percentage of the total drug cost. The Tier 3 and Tier 4 prescriptions is where most of the people run into the problems with their drug costs. They run into the donut hole because of the expense, and those Tier 3s and Tier 4s can get really pricey down the road. Tier 5 drugs are specialty drugs, and not many people have these. They are some of the really disease-specific prescriptions. There's some oral chemotherapy drugs that fall into that. Some immune therapy drugs fall underneath that, and they are very expensive no matter who you go with. So now maybe you're thinking, well, I don't take any medications. I'm not going to get a Part D plan. Well, even if you're taking 0 medications, I highly recommend you take out a Part D drug plan. If you don't take one when it's first available to you, you will be penalized when you finally do get one, and that penalty will be for every month that you did not have one, and that penalty lasts for life. It is added onto the premium of your Part D plan when you get it. It is collected by the insurance company of your Part D plan and then paid to Medicare. The only way to avoid the Part D penalty is if you have something like the VA, or some states have things like senior care where they have their own Part D plan. But if you do not have a qualified Part D plan, you will pay for it down the road. Now, Medicare supplements are not part of Medicare, but I'm going to touch on base with them here just because so many people have them, and they will call them Part N or Part G, when actually it's Medicare supplement plans. It would be Plan G, Plan N. And Medicare supplements do exactly what the name says. And I will have up here at the top, I'll link to a video that explains the difference between Medicare Advantage plans. Again, they do just what the name says. They supplement original Medicare and are sold by private insurance company. Your Medicare supplement will be your secondary insurance. Depending on what supplement or plan you select, it can pay for most of those copays or coinsurance that you would have been responsible if you just had original Medicare. Also know that Medicare Supplement and Medigap are 2 different terms for the same thing. So again, you're going to sign up with the Social Security Department for Medicare. You're going to do it 90 days before the first of the month of your 65th birthday. Part A and Part B are original Medicare. You will then decide if you want a Medicare Advantage plan, Part C, or a Medicare Supplement. And you will need a Part D, whether it is part of the Advantage plan or if it is a standalone Part D with a Medicare Supplement. I hope this has answered some of your questions. If it has and you like the video, please click on the thumbs up and like the video. It really helps us reach our senior population, and subscribe to the channel so you get notifications when we put up a new video on Medicare or Medicare Supplement. Again, I know this probably brings up a lot of questions, but if you will click on the link down below, it's in the description, set an appointment. You can pick a day and a time that fits your schedule. I'll give you a call. We'll go over it. We'll discuss the costs, what plans fit you the best, and see if going on to Medicare when you turn 65 is a better option for you. Thank you for watching, and you have a wonderful day.